Managing constipation caused by pain medication. A common but distressing side effect of taking pain medication is constipation. Managing constipation is very important to us, and we know it is important to you. One of the most important missions of our organization is to train caregivers what to do when your loved one is experiencing constipation. Constipation is the passage of hard, dry stools less often than what is normal for you. Frequency of bowel movements is not the most critical factor, but comfort having them. Other symptoms which we need to know about include: are you straining during a bowel movement? Bloating, swelling of the abdomen? Is there cramping, nausea, vomiting, reflux, and heartburn? It varies how often a person has a bowel movement. For some, 3 times a day is normal, and for some, it may be 3 times a week. Opioids, such as morphine, are medications that are used for the relief of pain. Opioids also slow the movement of the bowel, which leads to constipation. It is common to have constipation when taking an opioid. It is important that when opioids are prescribed, that a bowel regime is also started. Laxatives should be taken as regularly as the opioids. Your care team will discuss how to treat the side effects of the pain medication, including constipation. It's best if we can catch constipation as early as possible. So please let your nurse know if you experience a change in the frequency of the bowel movements, a change in the stool consistency, a smaller size, liquid stool, an urge but the inability to pass stool, or rectal fullness or pressure, changes in the amount of gas passed. The good news is that there is much you and your caregiver with your care team can do to provide comfort and reduce the risk of constipation. Your care team will always try to find the cause and discuss treatment options with you and your caregiver. Some things that may help are taking pain medication and laxatives as directed by your hospice nurse, drinking warm fluids with or after a meal to help with digestion, increasing fluids as tolerated, including natural fiber from fruits and vegetables and whole grains as tolerated, and if possible, increasing physical activity. As always, we are available to help and train you 24 hours a day. If the constipation is not relieved, or if it's getting worse, please contact our 24/7 patient priority line at 772-403-4500.